friends, I'm Stephanie Carter-Kelly. I'm a physical therapist who uses yoga in just about everything that I do. This week, we're talking about strength, specifically strength of the back and of the legs in order to give you more relief of your low back pain. Even if you have disc or joint pathology, a little bit of degeneration in that spine, strengthening is a way that you can make yourself feel better by supporting that area when you get your back stronger. When you're working on getting your legs stronger, then you're creating shock absorption for that low back area, so that each step that you take doesn't necessarily translate all the way up into the spine. These strong thigh muscles are going to help absorb the shock before it gets into your low back. And the other thing about strength, especially when working these big muscle groups, is we're going to help the brain. We release hormones when we focus on strength training in the legs that can help make us feel better, even emotionally, psychologically. It can help alter our mood. We can change the structure of our brain by strengthening our legs. So we can see direct effects of strengthening. So for the past 6 months, I have been doing some strength-focused classes with my group of people that have chronic pain, and I can really see the difference in them. And they even say they notice those changes. They're able to do more because they're now stronger. The other thing, when we talk about strength, we can also talk about the strength of our will. When we can get physically strong, then we have more willpower to do the things that we want to do. We have more willpower to commit to making changes for a healthier lifestyle. The two go hand in hand. If we feel weak and lack energy, then it's hard to make that nutritious meal, or it's hard to even have the energy to put on the shoes and go for the walk. So it's not just about strengthening our muscles, it's also about strengthening our will. Right in this area, this is our energetic center of our body. And when we can strengthen our core and strengthen our legs, then we're gonna also strengthen our will and have more power. So I got out my stick today so that I can show you very specifically a safe way to do this, especially if you have back pain. Many people, when they get in and out of a chair, they kind of lean forward, even push off of the legs in order to stand up, which is not a very strong way to stand. So grab a dowel rod, a golf club, or even a broomstick, and align that stick up on 3 parts of your spine. The very low spine, almost to your tailbone, but it's on the flat part of the sacrum, the mid-back, where you're rounded, and then on the head. And see if you can hit all 3 points of the stick. Now what you want to practice, in order to stand up, you first need to get this lean forward so that you can keep your spine straight. Just this motion will begin to build strength in your back, because the back muscles have to hold the spine in a certain way. As you lean forward, these back muscles have to kick in. So all the leaning forward comes from the hip joints, and the muscles of the spine are working and getting stronger to support that spine. So you have to get that forward lean first, because then you go to stand up and you keep a straight spine even as you stand up and sit down. When I give this activity to people with back pain, my patients specifically, it's really hard to do. So even just using the stick several repetitions to get that lean forward and move to that stand is a great way to start this practice. So give yourself a few days just to develop that movement, that fluid movement of standing up and then sitting down. Make sure you shift the hips backwards as you lean forward. You don't want to lean too far, and a lot of times people will lean too far and they'll pull their head off of the stick, or it'll tip off the back. Keep a straight spine and practice that. So that's sort of step one in developing a strength practice. The next thing, intermittently throughout the day, you just want to stand up and sit down several times. So your arms can be anywhere, but you want to line ankles, knees, and hips up. Arms across your chest, arms out in front of you, and just stand up and sit down. And very slowly sit down. Sometimes people will sort of fall in those last few bits, they'll fall into the chair. I want you to think of controlling it on the way down. Develop those thigh muscles. So that's the second step. The third step, you're not even going to sit, but you're going to touch your bottom on that target. So you're just going to touch and come right back up. Touch so that you know you're getting down to the chair and then come back up. So this takes a while to develop because it's a lot of control, especially if you fall into the chair. Now you need to develop some better strength. And so your hands can stay right out in front of you. If you feel like you have the motion, you can always bring them up so that you're doing more of that chair pose position. So repetitions. You can also just go to the chair and hover so that you touch and just hold. I'm not sitting, I'm just holding, or I can hover just above the chair and start building strength that way. That would be a fourth way to kind of start building some strength. And you'll notice you start breathing hard, and that's good. So again, the more you can kind of intermittently do this throughout the day, you'll pump those legs, you'll get your heart rate up a little bit. National guidelines are now that you can do exercise in 10-minute increments. If you're wearing any kind of activity monitoring device, it'll give you credit every time you get your heart rate up. So even 10 repetitions of this sit to stand will start to get your heart rate up and you'll start to feel it in your legs. The other thing I do is if I don't have a chair available, because we do this in the yoga class, is I come to a wall, placing my feet hip width distance apart, kind of hang onto the wall, set the tailbone on the wall. It's like a wall squat, but I don't want your back on the wall. I want you leaning forward again, thinking about that, aligning that stick along your spine, even in this position. So you're holding that forward lean position, and you can build up strength this way. You can actually even get a little bit lower here, and then again, up, and then touch that tailbone back and come back up. This is what we do in our class. So if you're in an office where you only have a rolling chair, you might want to just use the wall in order to start building. If you're really good at this and you want to take it another step further, I've taken a block stack. You can just take a low footstool, something to start getting you down even lower. Now, I know that some of you have knee pain, knee problems. When you start back in the chair and you're going up and down from that seated position and you feel it in your knees, I always tell people, is it pain or is it just like, the muscles are burning? If you really feel pain in the knees, you can also always adjust your stance. You can take the toes and roll them out just slightly. You can take a little bit wider stance, maybe a little bit narrower stance. Anything that you want to do in order to change the sensation of your knees. This is not a bad activity for your knees. It's actually one of the other things that we would do for somebody that has knee pain. So don't give up just because you feel it in your knees. Either start with a higher seat or adjust the position of your feet. Make sure that they're symmetrical on each side, but just adjust. And almost all the time, I get people to say, oh, well, that feels better in my knees, and so I can do more repetitions. And the more you do it, the less you're going to feel it in your knees. But you may want to start a little bit higher if you do have some knee pain. Now, if you really want to challenge yourself, you get a low seat. Your goal really is to get, I'm a little bit lower now, but think about getting your femur, your thigh, parallel to the floor. But this is a challenge. Like if you have trouble getting up from a floor, you want to challenge yourself to get up. Come from that low squat. We want to be able to get down to the floor. And so start even sitting on a low stool just to get that sensation in your hips and your knees so that when you want to go to stand up, you can do it. So that is some progression. Start in a chair with the stick and get that forward lean first. And then use the stick to stand up from sit to stand. That's a really early start. If it hurts your knees, get a higher chair. Raise your chair up, put a cushion in your chair. Anything to ease the sensation in your knees, but keep doing it. Do it every day. You can do this every day. If you think about it, you're getting up and down from a chair several times during the day. You need to do it at least 30 times, 30 repetitions of sit to stand every day just to maintain the strength that you already have. If you want to build strength, you have to do more than that, more than 30 repetitions. So, if you've learned something today, subscribe to my channel so you can get these tips on a weekly basis. Share this information with a friend. Share it with the people that are sitting around you today in your office. Have a little sit to stand or squat break to get the blood flowing and the brain engaged. Make sure you give it a thumbs up and come back each week to see more information. I'm Stephanie Carter Kelly, yoga physical therapist. Namaste.